Hello, I'm Dr. Hilary Jones. I'm a GP and medical broadcaster with over 35 years of clinical experience. Now here, I'd like to talk about sexually transmitted infections because anybody who is sexually active should think about those considerations. Now, many sexually transmitted infections are curable, such as chlamydia, probably the most common of all, usually curable within 1 to 2 weeks of taking the appropriate antibiotics. But other infections are present for a long time, if not forever, because herpes, for example, is a virus which can lay dormant in the tissues, nerve tissue particularly, and cause recurrent symptoms. So what are these sexually transmitted infections and how can we protect ourselves from them? Now, in the last year, when we collated statistics, that's 2017, there were around 420,000 cases of diagnosed sexually transmitted infection in sexual health clinics in the UK. Whilst there was an 8% reduction in people taking a chlamydia test and a 2% reduction in the cases of diagnosed chlamydia amongst the age group 15 to 24, that's largely because service provision has declined and there are many people who have chlamydia without even knowing about it. Their illness is asymptomatic. All the time, this means that they can pass the infection on to other sexual partners. These sexually transmitted infections are passed on through having unprotected sex with somebody who's already infected, and that can be oral sex, vaginal sex, or anal sex. Also, barrier methods such as the condom which fails can be responsible, so a condom which splits or comes off accidentally could be to blame. And of course, the greater number of sexual partners you have increases your risk of being exposed to these infections. STIs can have a significant impact on sexual and reproductive health worldwide. We know that many people are asymptomatic. They don't have any symptoms that they are aware of, and yet at the same time they can still pass on the infection to somebody else. Other people do have symptoms. It could be a discharge, it could be pain when peeing, it could be a rash, a sore, an ulcer. It could be any of these things. So if you're worried, you need to have a checkup. The implications of carrying these infections could imply infertility in the future. There can be tubal problems, ectopic pregnancy becomes more likely in the future, and transmission from mother to child, for example, can increase the risk of not just a premature baby, but also a baby that's of low birth weight and also stillbirth. So some of the implications are really serious. Other implications are increasing the risk of being infected with HIV, human immunodeficiency virus, which can lead to AIDS. The risk, if you have herpes or syphilis, for example, can increase that risk by 3 times or more. So how can you make yourself safer? How can you have safe sex and protect yourself against these infections? First and foremost, think about using a condom. It not only prevents unwanted pregnancy, but prevents transmission of these various germs. Have an STI test when you meet a new partner and are sexually active with that new partner. Finally, if you've been diagnosed with an STI in the last 3 months, make sure that any previous partners are notified. And you can either do this yourself or ask the sexual health clinic to do it for you anonymously if necessary. What sort of treatments are available? Well, many STIs are eminently curable within 1 to 2 weeks of taking the appropriate antibiotic. Chlamydia, for example, is usually cured within that period of time. Other infections may not be curable, but they're still treatable. If we take the example of herpes, for example, we talk about suppression to give you long-term relief against the likelihood of recurrence, and we can talk about short-term treatment of an acute episode where we would use an antiviral preparation such as valacyclovir or acyclovir. How can you test yourself? You can order a chlamydia test kit, for example, online from Coop pharmacy. If you have any reason at all to suspect that you may have been exposed to an STI, you can either go along to a sexual health clinic and be tested there, or request a test kit from them online. If you have been diagnosed with an STI, you can also order treatments online from Coop pharmacy.